Hey, everybody, we'll give everybody just a minute and then we'll get started. Thanks for joining us here at the end of the year. If everybody could mute themselves if they're not speaking, we're getting a little bit of feedback, I think. Thanks. We should get started and just assume others will join us as we get going.
That's fine. If we could go to the next slide. So let me welcome you. I want to thank you for joining us for the December meeting of the Alliance for Disease Prevention and Response. You know, this is a special meeting because it's not only our final meeting of this very, very challenging year, but of course we're celebrating our second birthday of the Alliance. And with that, we wanted to reflect on the past 2 years and also thank all of you for the hard work that you've done putting into the Alliance and making it what it is today. So to help us celebrate later in our event today, we're looking forward to having you share some of thoughts and reflections on the Alliance, and then also celebrate any other achievements or events that we want to do. So we kind of end the year with a lift up. If you go to the next slide, to show our agenda. So today's meeting, we're fortunate to have Dr. Jose Romero from CDC join us to provide us information on the tridemic that we're having. And hopefully you can also share us some suggestions on how the cross-sectoral group like ours can help to address many of these challenges. And then next we'll share a couple of updates about the process from the Alliance, our more equitable and sustainable public health system, and both Andrew McGowan and Steve Greeley will make those presentations. And then we'll have a group discussion as we talked about. Go to the next slide. Just one quick update. Some of you know the APHA usually kicks off each year with a Get It Moving challenge. So that, of course, will start after the first of the year. And so we just always encourage you as part of your New Year's resolutions to also make a resolution to improve your physical activity in 2023. So with that, again, let me thank you for being here, and let me turn it over to our updates. Angie, on public health prioritization.
Actually, sorry, first we're going to have Dr. Romero.
I'm sorry, Jose, I'm sorry. To hear from Dr. Romero.
Quite all right. Thank you, Dr. Benjamin. Thank you all from the Alliance for having me here today. Let me share begin by sharing my slides. Let's see here. There we are. Here, share, and go to that. Okay, can you see my slides?
Yes, we can.
Okay, here we go. So thank you again for having me. It's a pleasure.
I just don't think you're in present. I don't think you're in presenter mode.
I am. I'm not sure
You
why. I'm not sure why it's not. You know, it may be. Hang on. I'm doing two screens here, so let me try something. Let me try this. That may be the reason why. Let's try again. How about now?
That's great.
Yep. Okay. Sorry. I was splitting it into two screens. All right. Well, again, thank you very much. I'm just looking at my watch to make sure I stay on time. Thank you for having me here. As Dr. Benjamin mentioned, I'm the relatively new director of the Center for Immunization and Respiratory Diseases here at the CDC. It's an honor and a pleasure to be in this position and to be leading the center at a time where it is so critical that we work with you, our partners, in order to achieve our mission and our goal. We know that without you, we could not go forward with our agendas. So what I'm going to do today is give you an update on the circulating respiratory viruses we're currently seeing. That's influenza, respiratory syncytial virus, or RSV, and talk about COVID also. So here we go. So the CDC maintains, as you all know, a comprehensive layered influenza surveillance system to track when and where influenza is spreading and what types of viruses are circulating at any given time, and also including the severity of disease that's occurring. These systems consist of complementary components to capture virologic outpatient hospitalization and mortality data. As you all know, following two prior seasons of really relatively low influenza activity, we've seen early and significant increases in influenza activity this season, and it's going forward. As you can see on the left-hand side of the slide, the map, the percentage of outpatient visits due to respiratory illness is high across the country. It's approximately 6.9% nationwide, but you can see that there are some jurisdictions that are particularly hard hit. It's important to note that there may be a little bit of a decrease in the last a couple of weeks, although that may be reporting, but we'll talk about that later. All 10 HHS regions are above the baseline, their baseline, and 48 jurisdictions are at high or very high levels of activity. When looking at the surveillance data, it's also important to keep in mind that there are other viruses besides influenza that can cause an influenza-like illness. And those are, for example, RSV or COVID or SARS-CoV-2. And so they do contribute to this map, but it's important to note that our systems for influenza clearly show that it is substantially contributing to the burden of viral illness that we're seeing across the United States. Now I'd like you to turn your attention to the right side of the slide, the yellow bar graph, and specifically, and I think you can see my pointer, the percent positivity. Influenza positive tests reported to the CDC show an increase in the number of these specimens that are positive that are being received by public health and clinical laboratories since October, although it's plateaued a bit in recent weeks. As of our most recent reporting week, clinical labs have reported that about 25% of the specimens are testing positive now for about the third week in a row. The majority of the viruses detected so far this season have been influenza A, H3N2. These represent 78.5% of those strains subtypes. The remainder, the 21.5%, are influenza H1N1, and we've seen very, very few detections of influenza B. The majority of the viruses tested this season are similar and are compatible with the vaccine strains, and we have evidence to suggest that the vaccine does protect against hospitalization from data obtained in Chile in the southern hemisphere. We also know that no viruses are resistant to any of the commonly used antiviral agents. I'll move on to the next slide. So influenza hospitalizations are shown here. So according to our FluServe-Net data shown on the graph on the left, the cumulative rate of laboratory confirmed hospitalizations was 32.7 per 100,000 population, and this is an increase from 28.2 the previous week. This is higher than what has been observed during the same week in any of the previous years, going as far back as the 2010-2011 season. So that's 12 years. That's a dozen years. It's too early to tell still if the trend will continue or if this season as a whole will be more severe overall compared to previous seasons. This rate is above or approaching the end of season rates, and you can see there for milder influenza seasons such as 2021-22, but well below the severest season, which is the 2017-18 season, with an end of season rate of 102.9 per 100,000 population. To the right of this graph, you're going to see the weekly rate of laboratory confirmed influenza hospitalizations for all ages. The weekly hospitalization rate in the last reporting period last week declined to 4.5 compared to 8 from the previous week. This apparent steep decline may be due to a data lag, and we'll see what happens over the next week or two as we begin to backfill some of this data. The rates of hospitalization are highest among persons aged greater than or equal to 65 years of age, and this is followed by children aged 0 to 4 years of age. And this has been true throughout the season. Ultimately, and unfortunately, as a pediatrician, I have to report that there have been 30 pediatric deaths reported so far this season. Moving on to guidance for the use of antiviral therapy in the setting of reduced availability of oseltamivir. The CDC released a HAN, a health advisory, on December 14th to provide interim guidance to clinicians to prioritize antiviral treatment in settings of reduced oseltamivir availability following numerous anecdotal reports of availability issues for this agent in various parts of the country. Now, it's important also to note that this reduced availability really applies to the non-labeled form of the drug. It's not Tamiflu, it's the generic form, it's oseltamivir. Availability issues may continue in some communities as influenza continues, as activity continues. In areas experiencing decreased oseltamivir availability, antiviral treatment should target patients with laboratory confirmed influenza who, number one, are at the highest risk for severe disease, and number two, are those who are hospitalized. If oseltamivir is unavailable, oral baloxavir, inhaled zanamivir, or intravenous peramivir can be used for early treatment of outpatients at increased risk for complications who present with uncomplicated influenza, depending on age and contraindications of the individual. Antiviral treatment of outpatients should be prioritized for persons who test positive for influenza within 2 days of the onset of illness. When there is a limited availability of antiviral agents, patients with a clinically mild influenza who are otherwise healthy and not at increased risk for complications can be managed with supportive care without antiviral therapy. The HAN further lays out guidance for prioritization of oseltamivir treatment in hospitalized, outpatient, and institutional settings. Moving on to respiratory syncytial virus. This is a graph showing RSV trends since 2019, so you can track the pre-pandemic era with the pandemic era. And as you can see, this is primarily based on the graph here. You can see that most of the activity is seen November through March and had a seasonal pattern. We saw no disease really during the first year of the pandemic. And then to our surprise, we saw an early surge of disease during the summer of 2021, falling down, and then having a large surge this year. This is what has led to this term, the tridemic, right? This is RSV, influenza, and COVID. So the good news is that the RSV activity is decreasing across the country. As this graph shows, that these are ED visits for RSV and RSV-like illness, such as bronchiolitis by age group. You can see that those children ages 0 to 1 year are very, very heavily affected by this virus. It represents data from the National Syndromic Surveillance Program, or NSSP, and represents about 75% of emergency departments nationally. So it's a very robust data set. This graph encompasses data as of December 10th, and as I said before, goes all the way back to 2019. Not shown here are our National Respiratory and Enteric Virus Surveillance System, or NREVSS, which demonstrates similar trends with decreasing test positivity in all HHS regions. We are also seeing more viral co-infections this year compared to previous seasons, mostly with rhinoviruses and enteroviruses. However, we are not seeing increased severity of disease this year. So we're seeing more cases, but they're not more severe, even when we take into account those co-infections that we're seeing. And this is comparing it to previous seasons. On our preliminary analysis, the length of hospital stays, the proportion requiring ICU admission or mechanical ventilation are similar to previous RSV seasons. So the weekly rates of RSV-associated hospitalizations by age group are shown here using RSVNet 2021 to 2022. I want to highlight on this slide that most RSV-associated hospitalizations are in that child age group between the ages of 0 to 4 years, with the highest rates occurring in infants 0 to 6 months of age, which is typical of this disease. Although these data are preliminary and subject to change, it appears that RSV hospitalization rates may be decreasing among children of all ages. So as I said, this arm of the tridemic may be fading away. So I'd like to wrap up with COVID-19. These figures are from our COVID-19 data tracker, which are available online and updated weekly. On the left, you will see trends in cases and test positivity since January of this year. And recent weeks, we've been seeing increases in detections, that's just shown in blue, the bars in blue, and in test positivity, the line in yellow. On the figure on the right, you see COVID-19 hospitalization, and these are admissions in black, which have been stable, but are now ticking upward as the news has reported. The red part of the graph represents forecasting for hospitalizations in the next few weeks. And the most likely scenario is represented in the dark red area and shows an expected increase in hospitalizations in the coming weeks. So just like it's your second year anniversary, I'd like to also point out that we are celebrating the second year anniversary of the rollout of the first COVID-19 vaccine in the United States. This occurred on December 14th. Since then, we, with the help of you all, our partners, have administered over 660 million doses of COVID-19 vaccine in the US. This would not have been possible without you, and we fully acknowledge that. And we want to continue our collaborations with you as we move forward. There's a quick note of invasive group A strep infections that we're seeing. Just want to mention that that's been pointed out. We are seeing more cases of group A strep. This is not viral, but it's a little added bonus. This most likely represents the fallout from increased numbers of respiratory viral infections that we see. And we are looking at this time. So with this, I will acknowledge those individuals that helped put this together. Thank you very much. And I'll entertain any questions that you have. Thank you very, very much.
Dr. Romero, thank you very, very much. Questions? You can use the raise hand function or wave your hand wildly. Dr. Romero, obviously, what can as you know, this alliance is a cross-sectoral group of folks, and if you had one thing you would like us to do, what would that be?
So let me take that and go often a little bit of a different direction. You know, one of the things that I am really a champion of, and what we've been thinking about, is a vaccines for adult program in the United States. And I want to introduce that if you haven't heard about that as of yet. It's modeled after the Vaccines for Children program. We have a budget within the president's budget for this year, and we're hoping that we're going to get that forward. So this all goes back to your first question. What can you all do? I think that the most important thing is that you try to communicate to the American public the importance of vaccines and the importance of programs such as VFC, Vaccines for Children, and the importance of a potential vaccine for adults program, which would offer newborn or nursery to nursing home vaccine coverage for adults. And as you know, as commercialization moves forward with COVID vaccine, these vaccines will not be available free of charge to everybody across the United States. And so we want to make sure that we have access of these for all persons, as many persons as possible, for these vaccines and other vaccines that are approved by the ACIP or have policy through the ACIP for their use. So your advocacy, you're speaking directly to the public. You're speaking to legislators about the importance of this program and the vaccines in preventing severe illness, and not only as a tool for pandemic preparedness, but a tool for overall health of the American public.
Thank you very much. I think I agree with you that the idea of having this program with the normalized vaccines in adults, which is something we really haven't done yet in this country. Did anyone know, I don't know if you know or anyone else know whether or not it made it through the Senate omnibus?
I don't know. I think that went through yesterday, but I haven't gotten a briefing on that from my team. So okay. I'm sorry if I.
No problem. We'll look it up. Chrissy.
I just wanted to answer your question. It did not make it into the omnibus, and we actually did a little media briefing yesterday and called out the fact that Congress failed to put that in from the president's budget. So we're there with you, Dr. Romero. We've been saying that in all of our vaccine communications about the adult piece. So we'll keep saying that.
It is a challenge, but we all are used to challenges, and we'll continue to push forward on this.
Lauren.
Thank you so much, Dr. Romero. My name is Lauren Smith. I'm at the CDC Foundation and also a pediatrician. So appreciate your points of view. One question I wanted to go back to is there's been, at least in my area, which is Massachusetts, sort of an increase in some parents and others bemoaning the precautions of mask wearing and in schools, et cetera, and which has created some tension among some of the public health officials in the region about whether to focus on the vaccine and getting people vaccinated for COVID and flu and but then the mask wearing. So I'm just wondering how you all are thinking about the prioritization of that, especially since uptake for the COVID vaccines has not been great among younger children, and certainly that creates the situation where things can spread easily there.
Yeah, thank you very much for that summary of the situation across the country, really. And what you're experiencing, I think, many states are experiencing. I certainly experienced this issue of masking in children in schools when I was Secretary of Health here in Arkansas. I'm calling in from Arkansas. So where are we with CDC today? Our emphasis remains on vaccination. That is trying to convince parents, public health officials, school officials of the importance of getting children vaccinated for vaccines that are safe and effective. We know that influenza vaccine is safe and effective. It's been around for decades and has shown its worth. And again, trying to educate parents about the importance of COVID-19 vaccination. I understand how difficult that is in today's environment. Having said that, other areas that we're emphasizing are these preventive measures that we can take ourselves and our children, right? That is cough etiquette, washing our hands frequently, staying away from individuals that are ill, not if we are ill, staying away from other individuals, and trying to use these personal methods of protection. And then, of course, the CDC doesn't make a firm recommendation, makes a statement that masking can be used in addition to that to limit source spread and to to protect the community. So those are our tiered messages, if you will, regarding this. I asked the question to our group whether we had enough data at this time to make a firm recommendation for the use of masks for the prevention of influenza. We don't. That's why we are making these recommendations that vaccinate, personal measures, and then by all means consider the mask as an option for that, to add to those.
Oscar.
Thank you. One quick question, or one or two quick questions. Recognizing the impact, as you mentioned, of the implications of what we've had of recently, and more so the role of vaccine refusers that has built into this our societal complex. Do you have any way of addressing what are those elements that will be very helpful towards addressing those particular pieces that has tied into mis and disinformation and its implication on not only, as you mentioned, the childhood vaccines, but of course specifically on adult vaccination efforts and the efficacies there? How do you imagine there to be opportunities for growth to try to address those elements?
Yeah, thank you very much for that question. I think what, if anything, what the COVID pandemic has taught me, both at the level of the state and at the level of the CDC, is that we need partners, community-based individuals, thought leaders, individuals in the home community of the recipients of vaccines, or those that have doubts or concerns about vaccines, in order to carry the message forward and champion this measure. It is the community individuals, these individuals that move those messages forward. And so I would say that what we need to do, what CDC needs to do, is work through you, and even at a lower level, that is community organizations, church-based organizations, school-based organizations, to get the message about the importance of the vaccines out there. That is going to be critical. Vaccine confidence is not a top-down issue. It grows from the bottom up. And that's what we need to do. We need to foster that. And that's one of the things that I'm trying to do by talking not only to you, but to other groups and meeting with them to try to offer that assistance and get that through. One of the programs that the CDC had during the pandemic was PAVE. And so, what the CDC did was very unique in that they worked with individual community organizations, small organizations that didn't have the expertise or the wherewithal to submit grants to the CDC. They funded support for them, helped them submit the grant, and then provided, if appropriate, funding that directly met the needs for that particular community. And that was very novel to the CDC during this pandemic period. I think programs like that, work like that, is very important. And those are things that we need to do, is work with the community, get the voice from the grassroots up and out, not down.
Dr. Romero, I know you've got to leave right now, but I want to thank you very much for your time today.
Thank you.
Maybe we'll have you back as this event matures a little bit more. So
As often as you wish, Dr. Benjamin, it'd be my pleasure. Thank you very, very much.
Thank you, sir. Have a good holiday too.
You also. Please take care, all of you.
With that, folks, let me turn to both Angie and Steve Greeley for some updates on our projects.
Thanks. Hopefully I'm here good. It just said unexpectedly, so I'm glad. Hopefully you all can still see me. We wanted to, if you can go to the next slide, Raya. We just wanted to quickly give you a little bit of an update about the projects that we've been working on over the last couple months. I know we've told you some about the two efforts we have, one really focusing on how to help prioritize public health. And so with that, we have been working through the many recommendations and findings that are out there. In a minute, we will show you the slides, but I can talk it through. We started in fall, really looking at the different national recommendations out there. With your help through virtual meetings, we've really narrowed down the list. We got to about 45 through for discussions with the virtual meetings. We then did a survey with many of you all, really to help to focus on, winnowing that down to what were the ones that we thought were most needed in areas of workforce, data and IT, law and governance, and also social determinants of health and health equity, and working with partnerships. And so after getting to about 23, which we shared hopefully by email, you all saw with all of you, we brought together a smaller group of about 30 people who are calling for now an accelerator group, who met at the end of last month, beginning of this month, to help us really think through how to really start to move this ahead. And so the group was able to help us to think about how to make these feasible. And so to look through the recommendations, each group came up with some summaries of what was happening. And so we have a list. I'm not sure. Sorry, it appears that let me look real quick. Do you all still just have updates alliance projects? Because that's what I see.
It says our approach.
Good. Okay, then it's just my slides that are not current. So that's good. So I will assume that we're on our approach. And so you can see that we're moving through different months and trying to figure out kind of the best way to figure out how to move ahead. And so we're winnowing things down to get to a list, hopefully, of priorities that we can all focus on. With that, if you'll go to the next slide, during the meeting we had, we talked about everything from kind of the focus we have. And so hopefully we're looking at the goal statement for the initiative. We had a really broad statement that looked at, the kind of the Alliance's mission, where we're going to, big picture, get to the robust, resilient system that we need. But we heard from the group that for these efforts to really think about prioritizing, that we also really needed to be able to hone in more. And so the efforts that we want to do as the Alliance, helping to bring together a number of different public health partners, that what we really want to do is to think about accelerate building this robust, resilient, and equitable community. And so with that we want to get to the public health system. And so we wanted to focus more on the public health system than kind of a healthier nation, which I think makes sense for us to hone things in a little. If you'll go to the slide on recommendations for focus, you'll see the 4 different groups. We'll share this with you all in a little bit. We're still kind of looking at the findings from our meeting, but you can see that each group had kind of a broader recommendation about kind of where they want to go, looking at, data and IT, at law and governance, kind of what we need to do, how to bring in social determinants of health, health equity, and partnerships, and how to advance the workforce. And so with that, we have recommendations on how to start putting that into place and some ideas of what we need to start on. And so we will be sharing those with you in early 2023. And we'll really be looking for all of us together to start thinking about, is this the right set of recommendations? Like, what else do we need to do to make these actionable? And to start to hopefully pulling together some efforts like a steering committee, like groups who want to work on these different efforts so that we can start putting them into place. And so with that, just know we will be back in touch a lot in the early part of the year, and we'll look forward to really running these by you all and thinking about how we can really determine together the strategic next steps for implementation. What we don't want to do, I think we'll keep repeating, is duplicate anything already happening. So we really want to assess what's going on out there already, what needs to happen to help us reach these goals. As you can imagine, some of the big things that really rose up to the top are that we need to take advantage of the knowledge of public health we have right now and some of the additional funding that's out there, such as the around $4 billion that just came out for CDC, and to think about how we make sure we're using that effectively and documenting how it's making progress. And 2 things that happen in every group are the fact that as a group in public health, we're going to need to think about how to move more towards advocacy and really speaking for what as a whole we need. And also to think about how we communicate about public health. With politics as they are right now, we've seen a lot of everybody's trying to figure out, how do we approach people? How do we have those discussions? How do we kind of prove the value that we all have? So All of those will be starting. We really look forward to working with you all on it. And I'll let Steve tell you a little bit about the work they're doing, and then we'll have time for a couple questions. But just know that today we really just wanted to give you a quick update and that let you know that we'll be in touch and sending information in early 2023. With that, I'll hand it to Steve, and I'm going to probably turn off my Zoom and join back in just a second to see if I can get the slides going. Thanks.
Great. So a parallel and connected activity is the development of a national plan to provide support for coalitions, local community-based coalitions that are working to advance public health and health equity. And we have a very strong working group on this that includes people who have been supporting coalitions on a very large scale through guidance and networking and funding. And also we have local coalition leaders on the group. And some of the first business that we went through was really to describe why is it important to build more systemic support for local coalitions, and the reasons that the group has stressed are that coalitions can be very strong vehicles for community engagement and greater shared power in decision-making and action. They can be vehicles to communicate and act from a position of trust. They can help bring the expertise of residents to bear in understanding where there are needs and how to address those needs. Coalitions tend to be strong vehicles for aligning efforts, and they also, in doing all of that, can help communities become more responsive to emerging threats or under-addressed issues. And overall, they're very valuable in advancing greater racial equity in the whole public health process. And so there's good, strong reasons to support them. And what we're working towards in doing this is to try to enhance a sustained, inclusive resident and cross-sector partnership in public health, both to understand the social determinants of health that are having effect on people, and also to, as I said, understand emerging threats and neglected issues, and to work towards more locally appropriate systemic change. And I'm going to see if I can bring up my screen very quickly, if you can see this.
We can see it.
Okay, and let's see if I'm able to actually, here we go. So we're working on these areas of planning, and these have been highlighted in discussions with coalition leaders nationally, and I think I've shared this with you in the past. But I'll just spend a moment in talking about some of the ideas that are emerging as we develop our plan. Let's see if I can do this. So one area is funding, and one idea is to work towards a federal funding stream that's explicitly dedicated to supporting coalition capacity. And there's a model for this. It's the Drug-Free Communities Act that is about 25 years old, and it provides more than $80 million a year to coalitions and sustained funding. And the big thing is it's relatively unrestricted funding, so it really supports coalition capacity rather than trying to direct coalitions to do specific things. And providing that kind of funding, you create some sustained capacity at the local level to work together. And then that actually helps coalitions be strong enough that they can seek other kinds of more programmatic funding as needed. Another idea that we're working on is to take steps to increase local philanthropy and health system funding at that local level for coalition support. Philanthropy has, by and large, hung back from supporting public health, but we think that there's a strong case to be made based on the lessons of the pandemic and also the interest that philanthropy has in advancing racial equity and quality of life at the community level. And so we're looking at convenings for foundations and health systems and others to promote the value of coalitions, provide guidance on best ways to do that, and possibly work towards some concepts such as has been in the case during the pandemic, pooled funding and participatory grant making. In other words, where actually people that work with coalitions directly are involved in making funding decisions. And then there are quite a few funding streams that will support coalitions, but more from a programmatic sense. So we want to create awareness of those. Then the other area we've been focusing on so far has been how to enhance the availability of guidance. Even within our working group, there is some really tremendous expertise in supporting coalitions. And so one of the things that we are thinking about is creating a TA consortium that could be strong in advocacy for coalitions, help enhance their voice in the process of developing broad-based public policy, and then taking on issues like how do you ensure that your coalition is inclusive and strong and effective. The Alliance, led by APHA, has also created this public health and equity resource navigator that I know you've heard about, Fern. And this is giving us an opportunity to explore the idea of a specific track for coalition members and leaders and people that seek to work with coalitions. And this would be a great opportunity to promote standards and best practices and give guidance and also provide, say, learning pathways of how do you actually form coalitions. And lastly, we're looking at the possibility of mapping coalitions and coalition serving organizations. The Alliance's mapping project has done a great job of mapping the Alliance members' efforts, and there's a tremendous amount now of coalition efforts nationally. It'd be really helpful to be able to see them. So if you're working in a community or a state and you want to know, where is their effort that's bringing residents together in multiple sectors together, you can find that very quickly. So that's where we are. We're also looking at the issue of data, and one of the things we're thinking about there is how to make existing data as easy as possible to use, particularly from a lay standpoint. There's a lot of great data out there. We want to take a hard look and say, how do we make that as easy as possible to use? So that's where we are right now.
Thanks, Steve. We have time for a couple questions if anybody has something. Otherwise, I think for all of these, we'll be back in touch soon to keep you all posted, but definitely wanted to make sure you all knew what was happening so that if you especially know of efforts or things that we should make sure are included or that we're keeping in mind, that we're incorporating everything. We definitely want to build off what's already happening, and our role is not to, recreate any wheels. I think that's hopefully a real plus of the Alliance, is making sure that we're working together. Anything for us? Great. I'll give it one more minute, and if not, we will move on to what I'm guessing everybody is ready for, is wrapping up the year.
Okay, go ahead.
Okay, great. So one thing, as we mentioned, it is our second year as the Alliance. So we just wanted to take a couple minutes to think about all the things we've done together. So Ryan, if you can go to the next slide. But then we also know a lot of you all, your organizations, I think we heard about the second year of vaccines, which is certainly a huge thing to celebrate. I know a couple of you have personal things that we're celebrating. So we just wanted to end this year on a positive note and hope that 2023 will both let us get towards, where we're trying to go together to have the public health system that we're looking for, but also some personal and professional excitement. So as the Alliance wanted to show, we have, as a group, we've come together. We've had 18 meetings since we started. We've presented at a number of different places. APHA is one of them. We together, refined what we started with to get to the vision and mission and goals that we have, which is something that we really appreciate with all of you all. We heard again at this last meeting that idea of building a movement and thinking about how to be aligned and how to bring in this cross-sectoral group to think about both public health and our public health system, as well as making sure that we're advancing equity and community is so important. And so that's something that I think we're really proud has continued throughout the time we've had. You'll see a couple of town halls that we've had with groups like the COVID Collaborative and APHA, with the Black Coalition Against COVID. There are a couple of pictures here. We developed FERN and the network map, which you've heard about. So got to go to the Public Health Law Summit. So you'll see there are many things we've done together, but just wanted to really highlight that we've been pleased to see all of you virtually. Hopefully in the next year, we'll also have more pictures as we see everybody in person. I should have done a better job about capturing Zoom pictures as well for kind of where we've been and what we've done. If you'll go to the next slide, Ryo was kind enough to take a list also of just all the topics we focused on. And so these are the different meetings we've had, and you can really see kind of what comes across, I think, are things that we talk about a lot. Of course, health, immunizations, vaccines, of course, over the last couple of years, coalitions and prioritization, equity, authority. These are all things that kind of we focused on and have covered together. So wanted to take a minute just to kind of look at those too. So, with that, I'll start just that it's been really great to work with all of you all over the last year. I know we were really fortunate to have a number of really strong organizations, partners, and people who have been part of this effort. I know we all thought we would move beyond COVID a lot sooner than we did, but it's exciting that together, hopefully we're a place where people could come together and learn and share. And I'm excited really to see where we go over the next year, working with everybody around the country to think about how we can really advance public health and also move towards better incorporating and supporting community coalitions and others. So thanks to everybody. It's been a pleasure, and hopefully we will get to continue that over the next year or so. But I also wanted to open it up to everybody else to talk about things that you're excited about the Alliance, about other collaborations you've been part of. And then you'll see here some other questions on successes that you want to highlight around, the Alliance, around public health and equity, or if you'd like to share hopes for 2023, anything that you'd really like to lift up just to help us all kind of reflect on where we've been, where we're going, and where we hope we can do together. And I will, with that, stop and kind of turn it over to some of you all. So feel free to raise your hand. You're also welcome to use the chat, share resources, pictures, etc.
Lori, let me put you on the spot for a moment. ASTO, NNPHI, and FAB, of course, have gotten some dollars for technical assistance. Any sense of how? Any sense of how you might be working with them on that?
Yeah.
Sure. Thank you. Well, of course, the way that DeNovo was written, whoever was eventually awarded the funding had to work across a broad swath of organizations and collaborate really fully to address the technical assistance needs. So I'm very hopeful that we will still be reaching deeply into the local health department level, and certainly we'll be sitting on, along with others across the system, advisory groups and that sort of thing to get this work done. I think from our perspective, the thing that we're going to be paying close attention to, and this is a little bit nuanced, and getting down into the weeds with the local health departments, but we are really worried about the way this was written was that the technical assistance aspect of the grants would be targeted towards the 114, now 104 directly funded awardees for the workforce dollars. And we had written in activities that sort of parlayed and spread our our technical assistance activities to reach the rural and the frontier and smaller health departments. So we're going to want to pay close attention to that, because obviously the workforce crisis doesn't discriminate by the size of the health departments, and the rural communities really already suffer quite a bit with the lack of resources. So I think the three organizations are now redeveloping their work plans and their budgets, and they'll get kicking off with their activities very quickly in 2023. But rest assured, for those who wondered where NATCHO was in this, that we'll be in it. We're very sad not to be a recipient of the funding. It was a technical error that threw us out. But the CDC is very reassuring that they will find ways for us to be heavily involved and for us to be working across the whole system. If that helps. If I could answer any specific questions.
No, that's good. I think you've identified a potential gap that we ought to all be paying attention to. So that's helpful.
Yeah.
Okay. Other comments?
And we've had some great ones in the chat room too. So just ask everybody to make sure to look at those also. So I see a couple of you all who I know might have very positive personal things, like perhaps moving on to exciting retirements. We have groups that have started, great publications that have come out. So feel free to lift up any of those too. We want to be able to celebrate.
Angie, one of the things that I think is really good is, there was a lot of work that was done, as you all know, through the Lights, Camera, Action initiative by the foundation. And out of one of the work groups during the summit number 4 on catalyzing cross-sectoral partnerships and working with, community engagement, there was a session around coalitions, and there's this notion about what needed to happen next. So it's nice to see the Alliance having picked up on that and carrying that forward, and to see, what happens next. So I think that's really good to see as an example of some action happening from a specific recommendation that came out of that work. And it's also, I think, interesting to see that from the meeting that you all had a week or so ago, the way that sort of the priority buckets are sort of lining up, very similar to what came out of Lights, Camera, Action. So I think that's really important to see that there is some synergy that's happening there, and making sure that we definitely look at all of those reports and action items too, so that in the spirit of not duplicating efforts. And then the last thing I'll just share with the group, it's certainly been my pleasure to be a part of this from the beginning and work with everyone. Many of you I've worked with in public health for a long time, and I'm actually retiring. So at least I'm saying that for right now, but definitely stepping away for a while, and wish you all happy holidays, and thanks for the opportunity to have worked with all of you over these years.
Thanks, Lisa.
Thank you, Lisa, for both of those.
Lauren and then Laurie.
Well, Lisa's a hard act to follow, and we're going to miss her sincerely and completely. So all sorts of kudos go to her for the wonderful work she's done. I did want to raise that last month, the foundation shared a new resource that's the result of a project that we have been working on with the advisory input of CDC, and it's about principles for using public health data to drive equity. And it's a guide to embedding equitable practices throughout the data lifecycle, from the planning all the way through data collection, analysis, meaning making, and dissemination, and then back again. So I'll put the I'll put the links in the chat. We gathered this or compiled this from a lot of sources. There's lots of work, obviously, that's been happening in the public health arena and that data equity arena. And this was our attempt to sort of synthesize and coalesce it in a way that hopefully would be functional, and by being able to see what you could do at the different stages, but also at different levels of government. So I just wanted to call that out, and I will share in the chat. So thank you.
Lori.
Yeah, I just wanted to mention something very positive that happened this week. And, we don't have a terrible lot to celebrate all the time in public health, but in the Omnibus package, we were successful, and Nature led the way in coalition, of course, with many others, but to get the public health loan repayment program into the Omnibus. And it has bipartisan support. It should remain intact. It's not as much money as we hoped, but at 100 million, it's better than nothing. We had asked for 200 million, but we're really looking forward to using that to help infuse some new life into the pipeline of the public health workforce. And just wanted to share that good news in case anybody missed it. Thanks.
Yeah, thanks, Lori. That's an important accomplishment. You're here. Okay. We're approaching 3 p.m. So any final thoughts from anyone? If not, let me just thank you all for this amazing couple years. And I look forward to working with each and every one of you next year. For the first time, we have money that has been, that's in people's hands now. And we have a range of pathways to do a lot of the stuff we've been talking about. So now the issue is, how do we get it done? So hopefully our alliance work will be able to kind of help stimulate and accelerate some of the work. And, I look forward to working each and every one of you as that happens over the next year or so. So happy holidays, everyone. And we'll be in touch. Angie, do you have anything?
Yeah, that's it. Thanks for a great year, and we'll talk to you all next year. And to those of you retiring or spending time with family, etc., congratulations on another great couple of weeks off for the rest of us.
Bye-bye, everybody.